This is Dr. Nathan Thompson with Exemplify Health Center. Today's exercise is the head weighting and the body weighting. So the head weighting and the body weighting is a fixed procedure. So it's something that you're going to be doing at the end. So you're going to be doing your repetitive cervical traction, any kind of isometrics, wobble, any kind of muscle stretching. You're going to be doing that first, and the last thing that you're going to want to be doing is any of the head weighting and the body weighting in order to strengthen the muscles around the spine in order to improve your posture. For example, forward head posture, rib cage going back, high hip, high shoulder, whatever that might be. So you'll notice that we've actually prescribed for you an exact position on where to place your head weights and your body weights. All right, so the first thing that we want to do is we want to show you when you unpack your head weights and your body weights, what you should be getting. So what you actually see here is you see all of the different head weighting and body weighting equipment that you're going to need for your spinal correction exercises at home. So the first thing that we want to show you is we want to show you this, and this actually kind of looks like a ball cap, and this is actually for your head weight that's going to be putting on your head and is going to be going on top of the head so that you can attach your head weights. This one right here, this is your actual head weight. This head weight is actually going to be velcroing to your head weight harness, so that way you can actually take it on and take it off. Now you're going to notice too that when you open up these head weights, there's going to be some weights that are inside of the head weight, and if you pull these out, you're going to notice these little bars, and each one of them is a half a pound. Now most of the times where we're starting you off is anywhere from a pound to 2 pounds of the head weight. There's 3 pounds that are actually in here, so we're going to go ahead and we're going to take 1 pound or 2 of these bars out. So now how we're positioning these is that if you are starting off with 2 pounds, you want these to be as close to the center as possible. So for 2 pounds, you're going to put them in the middle 4, and if you just have 1 pound, you're going to put 1 here and 1 here in the middle. Once you get those weights on there, you're going to go ahead and close this in order to secure the weights. This right here, this small piece, this is a kind of an accessory head weighting unit. So as we progress through your care, we may be prescribing this for you, but this, instead of going on here, sometimes we may be actually attaching this to the side of the head, up above the ear or below the ear, and this is for any kind of translations that we see or flexions that we see in through the neck. So we'll prescribe it for you if you're in this position, or sometimes you'll be in this position. This is just exactly like the head weighting unit. And so you see you'll open this up, and then inside are going to be your half pound weights. These units here is you're going to have 2 weight bags. You're going to have a 10-pound weight bag, which is going to look like this, and you're also going to have a 5-pound weight bag, which is going to be a little bit smaller. Now with that are going to be 2 different belts. This larger belt is the one that we're actually going to put for the we use this as a pelvic weight, and this will actually go through, when you're putting on the belt, the loops that you see on this weight. And this belt is actually going to be going on the neck. So you'll see that there's actually a pad here. This pad goes behind the neck, and then the belt will go through these smaller loops on this smaller weight. All right, so the first thing that we want to do is we want to show you how to use the head weight, specifically the headband in which we're going to secure the weights on the forehead. So you're going to notice there's a couple of different straps that we're going to use. The one that goes around the head is you can use this to secure the tightness around the head, and then you're going to notice 2 straps, and these 2 straps are going to go on top of the head. That controls the depth of where that head weight is actually sitting. So you're going to notice that these go in a crossing pattern. So the first thing that you want to do is you want to go ahead and secure the Velcro that's going around to the front, and then you're going to loop this Velcro strap through this loop, and then you're going to bring it around and then secure it through the Velcro. So that when you actually see this, you can see that now this strap actually forms kind of a dome that's going to go onto the top of the head. So you may actually need to play around with this a little bit and adjust it once you get it on top of your head. So we're going to put this on top of Kelly's head, and we're going to push this down as much as possible. And you should actually notice that the head weight should sit down right above the eyebrow. Now we're going to be ready for the head weights. You notice that there's Velcro on the back, so and the front of this is actually Velcro. So you want to go ahead and center this head weight right over the forehead. So we're going to secure that with the Velcro. And so you're going to notice that this is coming just right above the eyebrows. Now your response when you're properly wearing the head weights is your head should actually come back, the head should not go forward, and the head should not look up. So make sure that when you're properly doing it, your response should be that putting on the head weight and then the head starts to retract over the body. All right guys, so I want to show you a more advanced technique that we're going to do after we do front head weighting. Usually we don't recommend this until we're getting at about 60 to 70% of your curve back into the neck and the head is back over the body. And so if we're doing that, we take new x-rays, we see that you're still having some issues with any kind of curve in the lower neck or any shifting in through the upper part of the neck, then we may transition you into this smaller head weighting piece. And there's two different ways that you actually do this. Just make sure that you know that if we say right side or left side, I'm going to show Kelly's right side. So the first one is if anyone has any kind of issues in the lower part of the neck, which the head does this, and then the shoulder actually comes up on one side. So let's say that we were going to put this on Kelly's right side, and so we want to make sure that we have the head weight band properly secured, and that we're going to put this and think of this as going above the ear, closer to like above the eye. So we're going to apply this right here, and what you'll actually see is you'll see Kelly's head actually go to the side, and then what'll happen is then her body will then self-correct. So this would actually, we would call this a dog ear, and this is for any kind of curve that's in the lower part of the neck. All right, so the next one, instead of applying it above the ear, for some people who have a lot of shifting due to an atlas or a C1 subluxation or misalignment, this is actually going to go and hang down below the ear. So just make sure that you know whether we're prescribing for the right side or the left side, but let's say we're prescribing it to go onto the right side. So we're going to take this the smaller head weight, and there's a piece of Velcro that you actually see right up and through here. So we're going to take this part, and we're actually going to apply it to the middle of the head, and you're going to see that this weight actually will hang down. And that's going to cause her head to actually start to translate back to the center. So just make sure that you do this for the prescribed amount of time. All right guys, so the next thing we want to do is we want to show you some of the body weighting procedures in addition to what we just showed you with the head weight. So we're going to show you the most common combinations that we're going to be using in order to help correct your spine and your nerve system. And so we're assuming right now that Kelly is already going to be wearing our head weight. So with the type of body weighting that we have prescribed for you, make sure that you're doing all of that. So the first combination that's going to be pretty common is this is going to be the one where it's all in the front. So you actually see that Kelly has her chest weight here. You notice that the chest weight is going to go in the top part of the breastbone or the sternum. Make sure that it's not hanging down too low. And then these are the hip weights. So you notice that the hip weights are coming and hanging down in the front. So go ahead, and I want you to turn that way, and you can see kind of what that does. Now the purpose of doing this is to increase the curve in through the lower part of the back, and this chest weight actually helps to pull the lower part of the neck down, which makes it easier for the head to be able to come back over the body when you're doing your head weighting. Now what this also does is this provides a weight in the front of your chest that actually helps to shift the rib cage forward, so that instead of looking like this when we're applying the head weights, chest weight, and the hip weights, that we go from this position to this position. So assuming that Kelly is wearing her head weight, she has the head weight on, she's got the chest weight, and then she has the hip weights. Now what we recommend at home is that doing it on the ground is okay, but one of the things we found that works even better is that if we can put her body in an unstable environment, it will actually influence the pelvis a lot more. So we find it actually more beneficial that if you get something like a giant wobble disc or what's known as a balance pad, Both of these are available through Amazon. This runs about $30, $20 to $30, and the giant disc runs about $50 to $60. So let's put Kelly in the most unstable environment, which is going to be on this disc. So once she has all the weights on and the head weight on, she's going to be on the disc. You notice how unstable she is, and we're retraining the nervous system and the brain how to right herself and make her very efficient with gravity. So head weight, chest weight, and hip weights. This is the all-front body weighting and head weighting procedure. All right, so the next weighting procedure is going to be in through the pelvis, and this is going to be using the posterior hip weight, or the hip. Instead of the front, it's in the back. The reason why we do this is for a lot of people who have some issues in the lower part of the back where they almost have a sway back, or they have what's known as a spondylolisthesis, and typically they're in this position. So if we actually apply this weight, go ahead and turn this way, in the back, what we see is we see the actual pelvis go from here into this position. So in this case, we're actually trying to decrease that curve in through the lower part of the back. Let's have you go and face the camera again. And you're going to notice that on those hip weights, you're going to see that there's a pad there. So whether you have it in the front or in the back, just make sure that that pad is there to provide some padding and a little bit more comfortable. So once she has her head weighting configuration on, or anything else, she's going to go ahead and she's going to step onto either the balance pad or onto the wobble cushion in order to provide a little bit better environment for her spine and her nervous system to be able to stabilize and get used to that new position. All right, so the next body weighting procedure that we may be prescribing for you is, we call this the cross and the cross. The reason why we do this is for any kind of scoliosis or abnormal curvature in the lower part of the pelvis. So basically, a person who would need this configuration would be looking like this. So just remember to note which side we're asking you to do this weighting procedure. And for this one, we're going to be putting the top weight to Kelly's left and then the pelvic weight to her right. So we're going to be taking the one with the pad that's connected to the 5 pounds. We're going to actually cross this across the body, and you'll notice where this weight is going to be. Is this going to be right at the top of her hips, and if she holds her arms down, you'll notice that this part of her elbow will be centered right over that weight. So we want to make sure that we're crossing this across, and what we'll do is that will help shift the body away from that weight. And then the next one, the pelvic weight, or the 10-pound weight, we're going to go ahead and we're going to go from the left side and then cross it down to the right. And where this weight should be is that it should almost be, we call it the gunslinger. So it should start high and then come down, and that weight should hit almost that point of the hip. That's where you know that you have it positioned correctly. So now what's going to happen is Kelly's going to first shift her body away, and then when you apply this weight, she'll then shift it back this way. And so just remember that when you're doing this, you're going to do it either on the balance pad or you're going to do it on that wobble disc in order to have a maximal effect while you're doing the body weighting. All right, so the next body weighting configuration that we may be prescribing for you is, we call this the purse and then the hip hugger. Now you're going to notice that all of the weight is on Kelly's right side, located down by her pelvis. We recommend this for people, and in her case, someone who would look like this, in which the lower back is actually translated over, but it's actually failed to compensate to come back. So this is just for something that's translated down into the lower part of the back like this. So what we're doing is we're going to be taking this weight with the pad on top, and we're going to bring this down below, down towards the pelvis, and you're going to wear that like you would almost be wearing a purse. And this hip weight here is going to go straight across, and it's going to hit here than that point on your hip. So it's going to be right up and through here. So you want the 5 pounds, you want the 10 pounds to be right there. And we found that when you actually put that weight there, it helps the spine to actually translate away from that weight. So this would be the purse, and this would be the hip hugger body weighting configuration. Now remember that when you're doing this at home, make sure that ideally you want to do this on the either the wobble disc or this balance cushion, and that is going to have the maximal effect on correcting your posture, especially in through the lower part of the spine and in through the pelvis. All right, so the last configuration that we may be prescribing for you is going to be one specifically for the pelvis. Remember that we may be wearing our head weighting, we may have a chest weight that's on there, but let's just focus on the pelvis. Now this is rotated pelvis, and for example, if you would look like this, then what we're going to be doing is we're going to be putting that pelvic weight, and we're going to be actually putting this right below that point on the hip that you feel right here. So they find that when we put this weight in the front, that it's going to take the hip and it's going to start to rotate it back. Now, we may be prescribing it for you in the front. We may also prescribe it for you in the back. Now, the reason why we would put it in the front or into the back is going to determine about how much curve that you have in your lower back. If we're putting it in through the back, we actually want the pelvis to flatten out just a little bit. So if we were prescribing for right posterior or right back, then you're going to position that pelvic weight right there, which is going to be right where you feel these hip bones in through the lower part of the back. Make sure that you do this on the balance pad or on the wobble disc in order to have maximal effect. This is the rotational pelvis body weighting configuration.